so much, Mr. President. ABC is reporting that your intelligence committee was warning about the virus as early as November and produced a detailed report about the outbreak in China. When did you first learn about the intelligence, and could you have acted on it then?
Well, I learned when I learned about the gravity of it was sometime just prior to closing the country to China. And when we closed up the flights coming in from China and various other elements, and then, as you know, we closed up to Europe. So I don't know exactly, but I'd like to see the information. Yeah, please.
President, a lot of Americans want to see businesses reopen,
Yeah,
get back to
so do
work.
I, more than anybody.
So what specifically has to happen for you to feel that it is safe to reopen the country, and what is your plan to do that?
Well, I think we can say that we have to be on that downside of that slope and heading to a very strong direction that this thing is gone. Now, we could do it in phases. We can go to some areas, which you know, some areas are much less affected than others. But it would be nice to be able to open with a big bang and open up our country, or certainly most of our country, and I think we're going to do that soon. You look at what's happening. I would say we're ahead of schedule. Now, you hate to say it too loudly because all of a sudden things don't happen, but I think we will be sooner rather than later. But we'll be sitting down with the professionals. We'll be sitting down with many different people and making a determination, and those meetings will start taking place fairly soon.
So you wouldn't do that until the health experts tell you it's safe to do it?
Yeah, I would rely very heavily on them, yeah.
Do you think, is there a system for monitoring and testing that you're looking at? That
Yeah,
will
we're putting
need
in,
that to be
yeah, we're putting in very heavy testing systems. We have the best testing systems. And again, don't forget, when we look at cases, I'm looking at some, I'm not going to insult anybody, I'm not going to insult any country, but I'm looking at countries that are showing less cases than us. That's testing. We're testing more than anybody. And you saw exponentially more than anybody by far. And our testing's become, I think it'll end up being a big strength. In fact, the other countries that the media talked about are now calling us for what are we doing and how are we doing it so quickly and where are we getting these tests, because our tests are really good now. They've been proven to be very accurate. Yes, please.
Thank you, President Trump. Two quick questions.
Yeah, sure.
One on infrastructure. Members of your administration and members of Congress have pointed out that the top paid federal employee, it's not the president, it's the head of the Tennessee Valley Authority, and he made $8 million last year. And
It's ridiculous. I agree. It's ridiculous. I think it's the highest paid government. Long before I got here, you said Tennessee Valley Authority, right? Has to be the highest paid man in any government. Makes approximately $8 or $9 million. I don't know the gentleman, but he's got a heck of a job. He gets paid a lot of money. He's been there for a long while, hasn't he?
This one actually is new. It came in April, but the previous
Well,
one
that's a separate, yeah, that's separate. But I'm talking about we just have some new people going on the board, I know. But as you know, that's a quasi-public agency. And whoever the head of the agency is, that person makes a lot of money.
If I could ask my second question.
Which is an amazing thing, right? And when we want them to do something, they're not there for us. That's not good. That's not good.
The second
They've been there
question,
for a long time. That's been a story for a long time.
and I assume that you would support reducing that salary as part of the infrastructure bill.
Yeah, reducing it by a lot.
Thank you. And my other question
That'd be
is,
the greatest job in the history of government, almost. Certainly if you're into money. Tennessee Valley Authority, that's right. Go ahead. I've been waiting for somebody to ask me about that. It's been bothering me for a long time, too. Go ahead.
One of the biggest rating hits of the coronavirus, aside from these briefings, has been a show on Netflix called Tiger King.
Yeah.
And the man who's the star of this is a former zoo owner who's serving a 22-year prison sentence. He's asking you for a pardon, saying he was unfairly convicted. Your son yesterday jokingly said that he was going to advocate for it, and I was wondering if you've seen the show and if you have any thoughts on pardoning Joe Exotic.
Which son? It must be Don.
It was.
I had a feeling it was Don. Is that what he said? I don't know. I know nothing about it. He has 22 years for what? What did he do?
He allegedly hired someone to murder an animal rights activist, but he said that he didn't do that, and he was.
Do you think he didn't do it? Are you on his side?
Well,
Are
I'm a reporter. I
you
shouldn't take
recommending
sides,
a pardon?
No, I'm not advocating anything.
As a reporter, you're not allowed to do that. You'd be criticized by these. Would you recommend a pardon?
I'm not weighing in on Tiger
I don't
King.
think you would. I don't think you would. Go ahead. You have a question?
like Joe Exotic.
I'll take a look. Is that Joe Exotic? That's Joe Exotic.
to get back to
Go ahead.
the coronavirus if I can, Mr. President.
Yeah.
Last week, your top experts were saying that we should expect 100,000 to 240,000 deaths in this country. You've been talking about how it looks like maybe things are plateauing. Are these numbers now being revised downward? I know you don't want people to stop social distancing and that sort of thing, but what can you tell us about the numbers? Are they being revised?
My impression, Jim, is those were the numbers that were set, and they were set as an expectation from quite a while ago. I think we're just doing much better than those numbers. If either of you would like to talk about that, it's a fair question. You want to come up, Deborah?
I know Dr. Redfield said something about it too.
Yeah, so I think many of you have done the analysis of the same models that we utilized. And if you do the models of the models, you end up with that range. At the same time, we carefully looked at Italy and Spain, and we are doing much better in many cases than several other countries. And we're trying to understand that. We believe that our healthcare delivery system in the United States is quite extraordinary. I know many of you are watching the Act Now model and the IHME model and they have consistently decreased the mortality from over almost 90,000 or 86,000 down to 81,000 and now down to 61,000. That is modeled on what America is doing. That's what's happening. And I think what has been so remarkable, I think, to those of us who have been in the science fields for so long is how important behavioral change is, and how amazing Americans are in adapting to and following through on these behavioral changes. And that's what's changing the rate of new cases, and that's what will change the mortality going forward, because now we're into the time period of full mitigation that should be reflected within the coming weeks of decreasing mortality. I mean, that's what we really hope to see. We are impressed by the American people. And I think models are models. I've always worked on validating. I spent my life validating models all over the world, and that's why we do surveys and surveillance, and we make sure that what we think is right is right. I think this will change how people look at respiratory diseases, because it will change what is possible when the globe, and particularly the American people, do this level of mitigation. And I think, as I talked about yesterday, we are still in awe, really, of the American people's strength in this and following through.
If I could just ask Mr. President.
Yeah, I'm going to do that. I'm going to ask Bob to come up just for a second. Director, I think that's it. They have done, everybody has done, everybody a great job. So those were original projections, and we don't want to say anything about beating it yet, but I think we will have a very good chance to beat them very substantially. Bob, please.
Thank you, Mr. President. I just want to add to what Ambassador Burke said. I mean, this is a consequence of the commitment of the American people. You know, a lot of us have always had challenges changing behavior, whether if it's exercising regularly or different habits with smoking. When it affects us, what's been remarkable to watch here is how the American public has changed their behavior when it protects the vulnerable. I think that's really what I'm so proud to see.
Mr. President, just a follow-up on something from yesterday and a quick just yes or no question. Yesterday you said you had not seen Peter Navarro's memo on the coronavirus back in January, February 23rd. Were you ever briefed on those memos? Did you ever discuss those memos with anybody?
I don't remember that. I've now seen the memo. I saw it. Peter sends a lot of memos. I didn't see the memo. As you know, World Health was saying that was not correct because at the time they called it wrong. But I didn't see the memo, but I acted as quickly as people were shocked that I acted so quickly, and everybody thought I was wrong because I did act so quickly, as you know, with respect to closing the borders, with respect not only to China, but with Europe. I closed the borders, and I think that was very important. But no, I didn't see the memo at the time, but I have seen it since. Yeah, please.
One other quick
Wait a minute,
question.
Jim, let me do a couple of others. We'll go back.
The head of the World Health Organization today warned against politicizing.
I agree with that.
And he said that consequence of this politicization could actually create more body bags. It's a pretty vivid image. I mean, what do you believe the consequences of the U.S. pulling out its funding of the WHO?
Well, I think when you say more body bags, I think we would have done and he would have been much better serving the people that he's supposed to serve if they gave a correct analysis. I mean, everything was, I said, China-centric. Everything was going to be fine, no human to human, keep the borders open. He wanted me to keep the borders open. I closed the borders despite him, and that was a hard decision to make at the time. We were all together. We made a decision against the World Health Organization. So when he says politicizing, he's politicizing. That shouldn't be. But look, we spend $450 billion, $452 billion, almost $500 billion last year, hundreds of billions in previous years. And they got to do better than that. They got to do better. When you talk about politics, I can't believe he's talking about politics when look at the relationship they have to China. So China spends $42 million, we spend $450 million, and everything seems to be China's way. That's not right. It's not fair to us, and honestly, it's not fair to the world. Okay, question in the back? Yeah.
Thank you, Mr. President. There's breaking news today, a couple of reports from a couple different outlets that Jared Kushner's team is seeking to create a national coronavirus database, a tracking system for patients who've been diagnosed. Now, his spokesperson said that that's not true.
Yeah, it's not. I have never heard about it. Doesn't sound like a bad idea, actually, but I have not heard about that.
Be okay with it if it.
I don't know if I'd be okay. I have to see it, but it sounds very scientific, and it sounds like it could be good based on tracking, but it also has to do with rights and lots of different constitutional questions. I have not heard that at all.
Okay, so some people are concerned it would be like the post 9/11 Patriot Act, that it ultimately led to the FISA abuse. Are there any? Are you concerned
FISA
about
abuse,
that?
of which I was the one abused, and a couple of other people, in all fairness. No, I don't know anything about it. I haven't heard it. I mean, I'll speak to them. I don't think so. They would have told me. I would have known about it. Please.
Thank you, Mr. President. The Nevada delegation is unhappy because smaller casinos and businesses that make profit
In Nevada.
from gaming in Nevada found out they're not eligible for the CARES Act PPP money. Is this, and I talked to one member who said
You
gaming.
mean because of the number of employees?
Because of the number of employees.
And yet they're small businesses.
And they thought gaming would not be treated any differently than any other business with this. Was this
Well,
an
I could look at
oversight?
that. I could look. It's a great state, and I will take a look at that strongly. Are you talking only the smaller casinos? Yeah, I'll take a look at that. Fine. I don't mind that. Please. Yeah, we'll take a look. Yeah, we haven't heard. Nobody's told me about it, but I'll look at it. It's a great state. They do a great job, so I'm going to look at it very strongly. I understand what they mean. Please.
Thank you, Mr. President. Turning to the economy, what if you urge Americans to go back to work and they don't listen to you? Would you leave that up to the governors, to businesses, to citizens to decide when it's safe to stop social distancing?
Well, when you say they don't listen, I think they're going to listen. They want to go back. Everybody wants. They're going stir crazy. They've been in those houses and those apartments, and they're built. I mean, they've really been. They've done a great job. Again, when you look, the question was just asked about, about how are we doing compared to projections. Those were just original projections. The big projection being 2.2 million people would die if we did nothing. That was another decision we made. Close it up. That was a big decision that we made. Two very smart people walked into my office and they said, listen, these are your alternatives. And that was a projection of, I guess, 1.5 to 2.2 million people would die if we didn't close it up. That's a lot of people. So if we do a number that's tremendously smaller than that, now if we did close it up, the numbers got to 100 to 220 million people. So if we can stay substantially under the 100, which was the original projection, I think we all did a very good job. Even though it's a lot of people. Say it?
You think we'll be on track for that by May 1st?
Well, right now, we're doing well in terms of the numbers. I can't tell you in terms of the date. We don't want to go down, and then we can start going up if we're not careful. So we have to be careful. As far as distancing, social distancing, and other things, certainly for a while, at some point that's going away. We'll be able to sit next to each other and everything like we have all our lives. This is a very unique thing. This has not happened anything like this of this magnitude since 1917, 1918, the great pandemic. That was something. But people want to sit next to each other at restaurants. They want to sit next to each other like normal at a football game, baseball game, basketball game, hockey game. No, we want to go back to life. Now, the first period of time, maybe we'll go a little bit slower and maybe we'll be talking about distancing. But at some point, we expect to be back like it was before. And hopefully, it'll never happen. Hopefully, it will. If it does happen, it's going to be in 100 years from now. The last one, 1917. That's something. That's a long time ago. And that was a horrible thing. Jim, go ahead.
Yeah, I wanted to get back to something you were saying yesterday about people going to Wisconsin and voting in the middle of this pandemic, really putting their lives on the line. And you said, well, if they do that, vote by mail, perhaps we'll have voter fraud in this country. I just wanted to ask you, voters in 5 states, Utah, Colorado, Hawaii, Washington, and Oregon, all vote by mail. Can you or the White House staff or your campaign provide any evidence to back up your claim that mail-in voting is rife with fraud, like the example you gave of people working in rooms filling out false ballots? You've been talking about voter fraud since the beginning of this administration.
Very fair.
And where's the evidence of it?
I think there's a lot of evidence, but we'll provide you with some, okay? And there's evidence that's being compiled, just like it's being compiled in the state of California, where they settled with Judicial Watch, saying that 1 million people should not have been voting. And you saw that? Did you, wait, excuse me. Well, I'm just telling you. I'm telling you, in California, in the great state of California, they settled, and we could have gone a lot further. Judicial Watch settled where they agreed that 1 million people should not have voted, where they were 115 years old and lots of things, and people were voting in their place. What I see, and every one of those states that you mentioned is a state that happens to be won by the Democrats. And if you have a position like me, where it's registered, you're here, and we're voting someplace where I'm not. I haven't left the White House in, I guess, months, other than to, ask a ship to, wave it goodbye to New York, which, by the way, is now going, as you know, being used for the purpose that we're talking about, which a lot of people wanted. Wait a minute.
Voting doesn't work out well for the Republicans.
Well,
so
it hasn't.
Isn't your concern
It
really
certainly
just political?
hasn't. But if you're a senior citizen and if you're somebody that needs it, I'm all for it. But they have to be very careful, because the things with bundling and all of the things that are happening with votes by mail, where thousands of votes are gathered. And I'm not going to say which party does it, but thousands of votes are gathered and they come in and they're dumped in a location, and then all of a sudden you lose elections that you think you're going to win. I won't stand for it. Well, we're going to find out about the proof, because you're going to see what's going on. And I'm not going to stand for it. Our voting system, first of all, we should have voter ID. When you vote, you should have voter ID. And if you send something in, you should be sure, as a state and as a country, you should be sure that that vote is meaningful and it's not just made fraudulently, because there's a lot of fraudulent voting going on in this country. This country should have voter ID. Okay, let's do another one. Go, please.
Mr. President,
Thank you,
currently the only way that we can track these millions of doses of hydroxychloroquine that are being distributed across the country is through the eHealth data system. How systematically is your task force watching this?
Well, I think it's very systematic. Yeah, we're distributing the hydroxy all through the country. It's being distributed in large amounts. We have it coming in now. We were up to 29 million doses. Then we went to 30 million doses. But we have it coming in all throughout the country, and much of it's being distributed. In fact, it'll start going down what we have in our stockpile. And again, it's had, I hope it works. Again, I'm not a doctor, as you possibly have found out. I'm not a doctor, but I'm a person with common sense. And we've had some very good results over the course, including a woman who just reported it 2 days ago. Yes.
Through the eHealth data system, are they?
I think no. We're looking to provide it in many different ways. In many ways, in certain instances, we've been asked. In the case of Michigan, we've been asked who the governor of Michigan would like to. I think she's become a big fan of it as a medication, as something that's going to help with this horrible virus. And we're delivering it to the governments of various states when they ask. So certain states are asking, certain governments are asking, and we're delivering it directly to the government. Yeah, please, go ahead.
Thank you very much, Mr. President. We know many people around the world are paying close attention to this
Yes.
press conference. So
Yes.
on behalf of
Good. Where are you
foreign
from?
media,
Where are you from?
I'm from Taiwan.
Good.
Yes. On behalf of Foreign Media Group, I'd like to ask you two questions. First question is that the French President Macron called Iranian President Rouhani and say that Europe has started to ship the medical goods to Iran. Will you consider
Medical goods?
Yes.
That doesn't bother me.
Yeah. So will you think?
If they're sending medical goods to Iran, it doesn't bother me. No.
Okay.
Okay?
Yeah. So the other question is that the world also paying attention to the U.S. election. So we are also we know that Bernie Sanders has dropped out
I
today.
did see that today.
Yeah.
Well, he didn't really drop out. He didn't really. What about his delegates? I mean, he said he's going to keep his delegates, and which is sort of interesting. He's going to keep his delegates, and he'd like to get more. Now, is he dropping out or not? That's not dropping out. When you keep your delegates and then you want more delegates before you get to the convention, that's a weird deal going on there. I don't know what's happening.
So what's
And I don't know why President Obama hasn't supported Joe Biden a long time ago. There's something he feels is wrong. Why isn't he'll come out? I'm sure he's got to come out at some point, because he certainly doesn't want to see me for 4 more years. We're not. We think a little bit differently. You know what? I'll tell you. It does amaze me that President Obama hasn't supported Sleepy Joe. It just hasn't happened. When's it going to happen? When is it going to happen? Why isn't he? He knows something that you don't know. That I think I know, but you don't know. So it'll be interesting. But with Bernie, I saw his standard fare today. I watched. And I hope that a lot of Bernie Sanders people, just like they did last time, we got a tremendous percentage of Bernie people. And I think they voted for me largely because of trade, because Bernie and I agree on trade. We agree that the United States has been ripped off by virtually every country they do business with. The difference is I've done a lot about it, and I'm doing more about it. And we've made incredible trade deals, including USMCA, the deal with China, and then all of a sudden that gets disturbed by this virus situation. But China has to spend almost $250 billion on purchasing our products, $40 to $50 billion with our farmers. And the Bernie Sanders people are big believers on what I'm saying on trade, and I got a lot of them in the last election that surprised people, but it didn't surprise me. No, those are great people. They're great people. But I just, look, I'm looking at Bernie Sanders. I watched this morning, and I said, what is that all about? Mike, you saw that, the delegates. He's not giving up his delegates. He's keeping them, and he said he wants to get more of them. And I think he's doing it to negotiate, I assume, but I don't know. That's a hard thing to do. Yeah, Jeff, go ahead.
Yeah, Mr. President, OPEC is meeting with Russia tomorrow and some other countries to discuss oil prices.
Yeah.
Oil prices are at $23 a barrel.
Oh, that's good. Finally, somebody knows something when they ask a question.
What is your message to them ahead of their meeting tomorrow? Will the U.S. consider a coordinated cut of production here?
I don't think, look, we already cut. You know, we're like very market oriented. If you look at Texas, and if you look at North Dakota, and if you look at some of our states that do this very well, they've already cut way back. You know, they cut back automatically. But in the case of Russia, in the case of Saudi Arabia, they increased production at a time when you didn't need it, and then they got hit by the virus, which knocked out 40% of the market, and now they're flooded with oil. Look, I just say this. You have two countries that are getting hurt very badly. Russia's getting hurt. That's their primary source. And Saudi Arabia, that's definitely their primary source. And it doesn't make sense that they flooded the market for whatever reason they did that for themselves. It's an argument that they had. And I think they'll straighten it out. A lot of progress has been made over the last week. And it'll be interesting to see what comes out of OPEC tomorrow. But OPEC, obviously, for many years I used to think OPEC was very unfair. I hated OPEC. You want to know the truth? I hated it because it was a fix. But somewhere along the line, that broke down, and it went the opposite way. And we have a tremendously powerful energy industry in this country now, #1 in the world, and I don't want those jobs being lost, okay?
What will you do, just one follow-up to that, sir, what will you do if they don't end up cutting
We'll
tomorrow?
see. I mean, I have a lot of options, please. Got a lot of good options, Jeff. Beauties. I might like it even more.
What
Now you'll watch. Let's see what happens. Hopefully they can make a deal. Let's go.
Thank you, Mr. President. Clearly, Americans are getting very anxious to go back to work.
I
There's
agree.
something optimistic.
Including me.
Still very vague. Now that the IMHE model specifically has been adjusted down to 61,000, when are we going to open back up? Can you give us a better date? Is it going to be April 30th, May 1st?
You said adjusted back down 61,000. What was adjusted back down?
The IMHE model, the one that originally predicted like between 100 and
Yeah,
200,000.
go ahead. Well, it's still a big number, right? 61, right? That's a big number. Go ahead.
But can you give us a more specific date? Will it be
Well, I don't
April
wanna do
30th,
that. Look,
May 1st?
I had a date, and I thought it was a very aspirational date. It's turning out to be very interesting because a lot of good things are happening by Easter. But I had a very aspirational date. I didn't think we could make it. I didn't say we would do it by Easter, but I said, boy, wouldn't that be great to shoot for Easter? That would be a great day, beautiful day, very important day to a lot of people like me and like some of you in the room, maybe all of you in the room, frankly. But Easter is a very important day. So I had, aspirationally, I said, let's see if we can do it at Easter. But I said it would be very tough. And I was criticized for that. So I don't like giving dates. And that wasn't a date. That was just an aspiration. That would have been incredible. But I don't think we're going to be very far behind. And some of these models are looking like Easter is going to be a very important date anyway because of the curve. I mean, it's hitting the top and it's starting to come down. And one person said Easter is looking like a good time. So a good time for that, for heading down. So we'll see what happens. Look, there's no reason to do that. We have a lot of good things happening. When I spoke to the governor of Louisiana today, he said, Tony, they need far less beds than they need. I said, well, good, because we're building 1,000-room additional. We built them 1,000 beds, and now we're building another 1,000. And I said, listen, is there a way that we don't build? I don't want to build them if they don't need them. In New York, the Javits isn't too heavily used. It's ready to go. 2,900 beds. Plus, we now have the ship set for COVID if they want to use it, and we're using it for Governor Murphy in New Jersey. So we'll see what happens. But, the numbers are coming way down. The ventilators, we're all set. We have a lot to go if we want, but I'm not getting calls where they need ventilators anymore. So we were right on those ventilators. I'd love to have additional ventilators for some of the countries that are our allies and our friends. And even if they're not our allies and our friends, you're saving human lives. But I'd love to see if we had some. I mean, we're making a lot of ventilators right now. We have and they take a while to make, and they're very expensive, and they're very complex to make. But I'd love to be able to help other countries once we're taken care of. But I just sent 100 ventilators to Colorado, and that was great. A senator there who's a terrific senator, Cory Gardner. And he called me last night. He said, could you get 100 ventilators for Colorado? And we just sent them out, and they'll be there very shortly. So, but it looks like we're in great shape from the bed standpoint. It looks like we're in great shape from the ventilator standpoint. And you just heard I ordered 500 million masks, 500 N95s and others, and surgical. But we ordered 500 million masks, 300 and 200. And they're going to be here very shortly. So we're really in great shape. And we started off with an empty cupboard. So I'm going to leave the vice president and his group to handle it, and I will see you probably tomorrow. Okay? Thank you. Thank you very much. Thank you.
You don't have any investments in hydroxychloroquine?
No, I don't.
Okay.
No, I don't. Thank you. Good question.